Minister Dunn, it's lovely to see you here in the Chamber today. 169 million winter plan, October 2022 to March 2023, announced on the 11th of October 2022. Senator Buttimer asked for a debate on it at the order of business the next day. In December, Senator Maria Byrne asked for a debate on the winter plan in the new year in light of the failure to meet targets in recruiting consultants. No debate was ever scheduled and you, Minister, never came in. Not that it matters anyway. Every year we have a winter plan, which I'm sure hundreds of man-hours are spent drafting, and then hundreds of millions of taxpayers' money is spent on that said plan. And yet the papers tell the same tale. HSE stretched to the limit. People on trolleys over the Christmas. This is the year the HSE breaks, etc., etc. Nothing seems to change. Well, that's not true. We pump billions more into the HSE every year for what feels like no change. The government's annual expenditure on healthcare has increased every year without fail since 2014, sitting in 2020 at 26.4 billion. I shudder to think what the figure for the last 2 years will be. Maybe I'm the odd one out, but I care a whole lot less about Pascal Donoghue's 4-figure sum than I do about the HSE's 11-figure sum, tens of billions spent annually on what feels like a propping up a rapidly deflating, bouncing castle. Here's a brief snapshot of Ireland's healthcare system, the most expensive out of the EU's 15 on the basis of national income. Nurses working in horrendous condition as 100,000 patients left on trolley. The Irish Nurses and Midwives Organisation warned that workers are stretched to the limit while staff shortages reported across the country. There are still almost 900 vacant permanent consultants posts in this country, as well as hundreds of unfilled non-consultant hospital doctors posts. Each and every person still working in this system continues to work daily to compensate for these hundreds of vacant posts, often filling roles meant for 2 people or more. We are competing against countries like Australia and Canada for doctors, and frankly we are losing those competitions in being able to recruit doctors. You said earlier this month that the overcrowding in hospitals was going to get worse, and that the HSE is to call on senior medical staff, such as consultants, to come in at weekends for the next few weeks to help alleviate the situation. The fruit of that, HSE HR is sending emails to doctors looking for an explanation from its staff who can't assist with our extra hours, citing the unprecedented situation the hospital finds itself in. It's not really unprecedented though, is it? For years, due to systemic failures at organisational level in our bloated healthcare system, even the most modest increase in demand for capacity has signalled some sort of crisis in our hospitals. And in the face of all this, the decision has been made to waive hospital charges for patients in addition to ER. What planet are we living on? Burnt out nurses, doctors doing the job of 2 people, 100 consultants post vacant long term. Let's open the floodgates and have every Tom, Dick and Harry with a rash or a stuffed nose head into the waiting rooms, because sure enough it's free, isn't it? Everything in your remit is now an emergency, and you need to show up to provide answers to senators face to face. Last year you appeared in the Senate 4 times, including debates, legislation and commencement matters. Do you think that's good enough? People are dying on trolleys in our emergency departments. Do you think that is right? I care little about health services in other parts of the EU. This is our country, this is our people, and it's on your watch, Minister. Why wasn't there consultation done with the nursing homes before November and December? You knew this was going to happen. It should have been done. When it comes to community care doesn't open over Christmas. It doesn't open, Minister. I had a situation where I had an elderly couple where the husband ended up in hospital. The carer of her son ended up being taken into a hospital as well. She had dementia. She had no one to care for her. Who did I reach out to? Who could I reach out to? The doctor on call couldn't be got. People were ringing the doctor on call for 3 days. My only reach out was to the local Gardaí or ring the ambulance. That was the only choice I had. So The citizens deserve better. Your voters deserve better, and you know that. Thank you.